Hello viewers, you're welcome to another episode of NTNI Television. Today we'll be discussing about how to avoid mental health breakdown or stress during this COVID pandemic. And with me in the studio is a seasoned mental health professional in person of Mr. Isaac Ali. You're welcome, sir.
Hello viewers.
So will you tell us more about yourself?
My name is Isaac Ali. I am a clinical psychologist, an assistant director. I work with the University of Abuja Teaching Hospital, mental health department.
Thank you, sir. So to start with, what is mental health?
Let me begin this way that often people mistake these two terms together, mental health and mental illness, to the extent that people use it interchangeably. But they mean two different things, though related. When we talk about mental health, actually, we're talking about a state of well-being in which the individual realizes his or her own potentials or abilities. And that individual at the same time is able to cope with the normal stresses of life. In addition, that individual is able to function productively and effectively. And to cap it all, he is able to make his own meaningful contribution towards community development. In other words, if one is not able to realize his full potentials, he is said not to be fully mentally healthy. If one is not able to cope with the normal stresses of life, he may break down. So, inability to cope with normal stresses of life is a mental health challenge. And when one may seem to be productive, but is selfishly orientedly productive, and does not care about making contribution for community development, that person is said not to be mentally healthy. So if we want to look at mental illness, therefore, you can just go for the opposite of what I've just made mention of. Thank you very much.
Thank you, sir. So COVID-19 has greatly affected or impacted on our lives. What are some of the mental challenges with this COVID-19?
COVID-19 is a pandemic that has not influenced FCT where we work alone. It has not affected Nigeria only. We all know that it's a global problem.
Yes.
The whole world at the time almost came to a standstill owing to COVID-19. Thank God for the level of success and the kind of recovery, the kind of equipment that we have, that we're getting over it gradually. But I want to say that it is a problem, it is a challenge that is affecting the entire world. And therefore, in the entire world, we can group all human beings into just but two categories. You either belong to the category of those who are infected with COVID-19 or those affected by COVID-19. Okay. Infected in the sense that one has felt some signs and symptoms for COVID-19, or he has come to the hospital with one physiological complaint or the other, and the health professionals feels that these symptoms are characteristic of one who has COVID-19 and asks the patient or the individual to go and do COVID-19 test, and he is diagnosed to be positive for COVID-19. So they are said to be infected. What about those affected? Any other one that is afraid or did not care to go and do the test, we won't know his status. Or those who have done the test, but they were told your result is negative, meaning the virus has not been detected in the sample collected from such an individual. Those people are said to be affected. How? In whatever way, you are either infected or affected by COVID-19. Affected in the sense that, some time ago, the whole world had to go on lockdown. You want to go out, you can't go out. Do you have COVID-19? You don't have it. That is how you are affected. Good part of government budget goes to healthcare or COVID-19. That money would have been used, to build, roads and other things for us, make social amenities available. But because of COVID-19, the funds have been diverted. So you are affected. So every one of us is affected in a way. Then if we want to look at the mental health component of how affected, we are in terms of COVID-19, we would put it this way. For those who are infected with the virus, we all know that there is a loss somehow, a loss of their health. So of course, to anyone that incurs loss, there will be a reaction.
Sure.
Mostly it will be that of anxiety or fear. Fear of the unknown, fear of being incapacitated, fear of dying, because we know that COVID-19 has claimed lives globally. So fear and anxiety is one of the serious mental health problems that grips people. Serious in the sense that anxiety may not be categorized as a very severe mental health problem. But I tell you, eventually it may lead to something so serious. Because though anxiety is defined as a benign mental health problem, yet, anxiety has incapacitated so many people as and made them not to be able to function effectively at work, socially, and otherwise. So that is a problem in itself. Fear has caused many people not to be able to go out, not to be able to reach out to people, to interact with them socially, and so on. So that is a challenge. What other challenge? We've had cases where people have been diagnosed with COVID-19, and owing to that, NCDC will come, to further investigate, people who are close to such index patients. And we've had cases where people begin to run away, they don't want, to be taken to the hospital for isolation and why is this so? Stigma and discrimination is one other mental health challenge that COVID-19 has brought. Even for those people who have been treated after isolation and they have been tested and have been said or declared free, by the time they walk around the street, people will be looking and pointing and say, that one also was tested positive. And you see people running away and they will not want to interact with such a one. That is a challenge on its own too. We also know that, COVID-19, brings disease burden upon people. It makes people to have distress. It makes people to have some level of disabilities, and it brings, financial burden on people. And this financial burden can go wide and affect several other aspects of one's life. That is a challenge that it brings. Economic challenge, financial challenge is an issue. Sometimes to treat ordinary malaria, some people cannot afford it, let alone COVID-19 with the challenges of it. So that's a burden that impinges on people. And owing to that, it brings about a lot of other mental health challenges. That is an issue. We also know that because of so many other complications that COVID-19 brings, some people, because of low coping mechanisms, they break down and it leads to depression. And we know that depression makes people become hopeless, feel worthless, and feel helpless. And these are prerequisites that can lead people to committing suicide, or homicidal and suicidal tendencies can be product that COVID-19 will bring upon humanity. These are some of the few issues that, for want of time, I would like to highlight to us as per some of the mental health challenges that COVID-19 has brought upon humanity. Thank you.
Thank you so much, sir. Even NCDC coming to pick people from their houses, coming with so much siren and noise, actually could be one of the stigmatization of people around. So please, what are possible solutions to some of these challenges?
Let me start this way that I found one thing that is so scary, particularly in the society in which we live today. Because of ignorance in the society we find ourselves, up till today, so many people, including those who have gone to school, those who have second degree after their first degree and so on, sad to say that there are people till today who do not believe that COVID-19 exists. They don't just believe that there is COVID-19.
That's very true.
While as a mental health problem, people so, as I've been trying to say, that my fear is not only for those people that are afraid of COVID-19, but those people who do not just believe that COVID-19 ever exists. That's my problem. So if I will want us to have an approach towards solving this problem, let's begin first by going on aggressive campaign, advocacy visits and so on, so that all of us are on the same page. Let all of us believe that COVID-19 is real. Until people are able to come to terms with the fact that it is real, they will not take any caution, they will not take any step towards solving that problem, because they don't even see the problem at all. So let's all of us continue on this aggressive campaign until every one of us come to terms with the fact that it is real. Then we will now all make effort and put our efforts together towards solving COVID-19 as a problem.
Sure.
Now, in addition to what I've just said, I will look at it from two perspectives. The individual has a part to play, and institutions or the government has a part to play. When I say institutions, while the government serves as one, non-governmental organizations, faith-based organizations, private industries, and so on, they have their own part to play. What part do they have to play? Like, take for example, if the government does not come out proactively to take certain measures by enforcing certain laws that will help us to take precaution, we all will become, at the end of the day, victims to COVID-19. Agencies that are responsible towards enforcing government laws have to come active, like ensuring that universal precautionary measures are taken. People put on face shield, face masks as they go out to interact, with others in society, not just to protect themselves, but to possibly protect others should they have COVID-19 unknowingly. Making sure that people don't enter, areas that possibly crowding may not be avoided. Ensuring that all the precautionary measures are taken. Like just recently, I went to Gombe to do one or two things. And I went to make withdrawal in one of the banks. And I saw many people, standing outside. They will not allow them go in. And I said, what's the problem? I was told they didn't come with face masks. But generally, if you go out there, you see everybody moving without face mask, without any protective device. So what is the responsibility of that bank as an institution to ensure that everybody complies with that government regulation? So government has a part to play. What about the healthcare system that is being overflooded? It is the responsibility of the government to make sure that our health institutions are well equipped with state-of-the-art equipment to make sure that when one is down with COVID-19, whatever it will take to resuscitate such a one, whatever it will take to, restore that person's to healthy state, the government has such equipment in place. That is another responsibility of the government, to make sure that water runs everywhere 24/7, so that people will comply with universal hand washing and several other social amenities that government will need to provide. It make that possible, or making the fight against COVID-19 workable. What again? A psychologist, Abraham Maslow, a humanistic psychologist, he would say that human beings have needs, but even the needs are ranked. There are those called the basic needs, that until the basic needs of individuals are met, they will never go to desire other higher needs. Food, water, and shelter are part of those basic needs. A man who is hungry, for God's sake, will throw caution to the wind, will never care about health issues. Even if you are telling him, don't go to such place, they will go there. Sure. Because of hunger, you will see a petrol tanker fall and petrol is flowing. People know the danger that a little spark will bring inferno and everybody there will rust. But you see Nigerians rushing there, fighting, scampaging, scooping, petrol product from the ground. They throw caution to the wind because of hunger. What am I saying in essence? That government should bring palliative towards helping people curb hunger that has ravaged the land. People who work for private, companies, private, schools and so on. Because such private schools don't have money. Their source of fund is from school fees. And schools are not operational. Where will they get the funds to pay their staff? Because of that, their staffs are not paid. People are hungry and they are asked to stay at home. They will throw caution to the wind. I think it is government's responsibility to be able to do something. Even if government cannot take over the responsibility of paying these people, even if it is just a relief material, even if it is paying, half of such people's salary. For God's sake, what is their sin? They have helped government to employ her citizens. That is the government's responsibility to employ. In other countries, that are well-to-do, they provide employment to their citizens. And the few that will not be employed, the government provide welfare materials for them. And if those private factories, industries, and schools could not pay, and government knows that they cannot pay, it is responsibility of the government to help them, since they have helped government by employing the citizens of government. But the government has not responded much in that aspect. I feel government has a part to play by responding to the needs of our citizens. And when we come to individuals have a part, to play. While it is true that government, can help us in making sure that, the health, system is well balanced and so on, it is the responsibility of every individual to make sure that he is healthy or he looks healthy.